Hello and welcome to the Global Dialogue. I'm Shereen Bhan. Every year for the last 6 years, the Bill and Melinda Gates Foundation puts together a report card of sorts of where we stand in being able to achieve the Sustainable Development Goals. And it's not surprising that progress has stalled, especially on the back of what we've seen happen through the pandemic and now the Russia-Ukraine war. Joining me now to talk about the highlights of the report and, more importantly, the call to action going forward is Bill Gates. Bill, always a pleasure. Many thanks for joining us here on CNBC-TV18. Let me start by talking to you about exactly that. Progress has stalled, and that's your comment. Health crisis, climate crisis, energy crisis, inflation crisis. Are there any silver linings at all at this point in time?
Well, absolutely. Yeah, we do have to be honest that we're facing more challenges than ever. And yet, we were making a lot of progress before the pandemic. And by staying committed to the aid levels and innovation, we can get back on track and resume the reduction in poverty, the reduction in childhood death, the empowerment of women, digital bank accounts, which even the pandemic, reinforced that India's innovation in that area let you get money out, particularly to women, in a very effective fashion. So we can't give up hope. Every life saved is super important, but we are way behind.
When you talk about being way behind, the big problem at this point in time is the resource crunch, and especially when we talk about governments. Fiscal space to be able to do the right thing. There might be the political will, but there isn't the capital at this point in time. How much of that is going to be a challenge, and what can foundations like yours do more than what you've already done?
Well, the big money in terms of helping poor countries is from the aid budgets of the rich countries. No amount of philanthropy can make up for that generosity. Philanthropy can participate, things like polio, Global Fund, the Vaccine Fund Gavi. Our foundation is right up there with some of the big European donors. We're also a big funder of the upstream innovation. So whether it's better seeds for farmers to deal with climate problems or new vaccines for things like tuberculosis, we are a very big funder. The upstream funding is less dollars than actually, once you invent the new vaccine, getting it out to the entire world. So there's a partnership there, but the commitment to aid generosity is difficult when domestic challenges like cost of electricity throughout Europe is demanding a lot more of their budget than it did before.
Absolutely, and which is why I asked, do you believe that given the resource crunch at this point in time, that 2030 looks like it's going to be out of reach?
Well, I know that the negative effect we've had of the pandemic, where childhood deaths went up somewhat, malaria deaths went up somewhat. I know that we can get back to where we were before the pandemic and make some progress. We will have less children dying in 2030 than we have today. We'll have, malaria progress will be actually pretty impressive because we have some new bed nets and new drugs that'll roll out. We won't meet the targets that we set. That was somewhat aspirational and didn't take into account the negative developments, which I'd include the fact that interest rates are going up. So the debt of particularly the African countries will be more of a burden to them, and we need to figure out how to avoid that. So it's pandemic, economic cycle, and the war all coming at the same time.
Yes, it has all come at the same time. I want to talk about food security because that is the essay that you've decided to focus on as part of the report this year. The IMF has warned about food protectionism. Many others are talking about the possibility of a food catastrophe. Is this the biggest risk that you are worried about today?
Well, food is absolutely critical. In fact, over 30% of the kids in Africa never develop their brain and body to be educated and contribute. And so getting rid of that malnutrition was already a huge priority. And now with climate making this even harder, yes, food security, people weren't paying enough attention to. The good news on this front is that we can improve productivity. You know, rich world productivity is far greater per acre than in developing countries. So as we give them seeds that are adopted to their conditions and find a way to give them good advice, probably using mobile phones for a lot of that, help them with credit to buy fertilizer, if we can double that productivity, then the calories are in good shape and they're not trying to import food from outside, which now those prices have gone up and made it unaffordable.
You talk about the implications of that for specifically Africa, and this is a challenge for most parts of the world today. But you know, when you talk about being able to increase productivity, you also talk about why we haven't seen much R&D innovation in agriculture, why we haven't seen spending on R&D innovation in agriculture. What's holding that back? You talk about the need for smart climate crops, but yet there seems to be suspicion around this area. There is a lack of uniform or harmonized regulation around the world. What's holding it back, you think?
Well, we had the great success of the Green Revolution in the 1970s, where India in particular, when they were able to get fertilizer with the new wheat, the new rice, the new maize, defied expectations of food shortage and actually raised calories per person because of this productivity. So that, you know, is a miracle. Some foundations at that time, Ford, Rockefeller, were partly involved in funding Borlaug. We need to do that again, but this time, you know, we know that sometimes fertilizer can cause negative effects. We know we need to get to the smaller farmers. We need to think about ecosystems that are unique. You know, Africa has a lot of orphan crops, things like millet, sorghum, that never got that attention. And so the amount of money going into seed innovation is less than $1 billion. You know, our goal for the world is that if we got that up to $2 billion, that would be the biggest thing to help avoid climate disasters that we can do. We need to do lots more, but that is the highest impact investment. There are safety concerns, and so making sure we have really good scientists in each country that can look at, okay, does this seed help with malnutrition? You know, is there a safety record? You know, some of that safety concern is not correct, but, you know, we still have to do those tests just like we do with medicines.
So a mix of global standards and, of course, local context. What's the best way forward?
Well, the rich countries need to up that global R&D piece. Every country needs then to take that and look at their ecosystems and adopt those crops. You know, within India, you have lots of different ecosystems, so it's not just one at adoption, it's probably a dozen for some of these crops. And then they get to look at what's known about the safety, are there any issues with this at all. So I'd say it's just a huge underinvestment and a realization that to adapt to climate, we need to improve seeds faster than ever before.
So how do you intend to break this cycle of underinvestment as part of the foundation?
Well, we're making a big commitment. We'll go through the numbers actually at the COP27 event in Egypt, that we're going to be a big funder in seed innovation. We're already one of the biggest, and we're making a substantial increase in that. We're also talking about, you know, as we look at climate, you know, how do you minimize the damage, and pointing this out, you know, in climate adaptation, which is the getting ready for the extra heat. It doesn't get enough attention, and we're not as good at measuring which interventions are the most impactful for climate adaptation, but it's very urgent that we get going on that.
If I can ask you a question that often comes up in the context of this conversation, why are you buying up so much farmland in America?
Yeah, I own, you know, through an investment office that invests in quite a few things, about 1/4000th of the land in the U.S. So it's a very, you know, distributed thing. There's not anyone who owns, you know, much of that land. They've decided it's a good investment. That's very mechanized agriculture, so not that similar to, who are trying to help out in Africa. So no direct connection there, but, the money that I haven't spent through the foundation, all of it will go to the foundation. But in the meantime, we invest it, try to get returns so we can have as much to send to poor countries as possible.
Let me talk to you about the pandemic. President Biden said that the pandemic is now over. We, of course, continue to have to deal with COVID. Most countries around the world have lifted all the restrictions. Vaccine distribution continues to be unequal. Large parts of the world still don't have access to the vaccine, even though supply is no longer a constraint. How do you read the pandemic at this point in time?
Well, there's vaccine. There's no
shortage of vaccines.
There's no country that doesn't have access to infinite vaccine. There's a question of does the population of the country want the vaccine? But we've been in oversupply globally. We have warehouses full of this vaccine, just begging for somebody to, want to use it. The vaccine is most impactful for the elderly, and so countries really should get the message out and try to get to 95% vaccination of those at greatest risk. India's actually got a pretty high vaccination level, but boosting is going to be necessary and particularly targeted at that elderly population. So, countries are behaving, most countries, as though the pandemic is over. That is, they're not locking down, they're not wearing masks, and yet the deaths continue. We have some risk of a new variant. We hope that doesn't happen. And then we also have, over the next few decades, a chance of another pandemic. And, I'm hoping that the world takes the lesson and that we're better prepared to act quickly. If you act at the very beginning, you can stop the global spread. You can stop it getting to billions of people. And so that dialogue has started, but not gotten as far as I would have hoped.
Why do you think it hasn't gotten as far as you would have liked?
Well, partly there's a lot of things, not to be U.S.-centric, where if the U.S. does a very good job on something and then leads the world in saying, okay, we need to do this, that's a very effective technique. The U.S. CDC did not do a great job in this pandemic, and so they're going through some reform and reorganization to get their act together. And I think their voice as they regroup will be important. It's a credible voice despite the mistakes they've made. So, we have that. We have the Ukraine war is just a gigantic tragedy that in terms of budgets and time, meetings like G7 where pandemic preparedness should be the top of the list, of course it's pushed down with the dire circumstances around the war. I do think the world is rational enough that we will get a plan together. We need all the countries to push for that. There's lots of ideas out of India of what went well, what didn't go well. Ramping up vaccine manufacturing and doing the distribution. There's some positive lessons from India on that. Getting money out to people who needed it, but we're a little slower to focus on this than I would have expected.
Since you talked about ramping up vaccines, and we did see the ramp up happen, but it was well into the pandemic. Is there now the possibility of a change in your view or your approach or your position as far as IP protection is concerned when we talk about vaccines in specific?
Well, the Gates Foundation makes sure that IP never stands in the way of low-income countries. We are the best at getting vaccine prices down. We make sure there's lots of competition in that market. We make sure it's tiered pricing. IP did not delay vaccines. AstraZeneca was going out to everyone and saying, if you have any capacity with no royalty, make this. And so there are issues around IP, but in the COVID vaccine case, because of great work by AstraZeneca, Serum, and many others, in no way did that delay the vaccine. So it's just a mistake to connect those issues.
Let me talk to you about what the other risks that you believe at this point in time require focused attention. In terms of silver linings, we saw a significant amount of progress being made on HIV, but that's stalled as well. In fact, since 2016, I think we've seen the lowest decline, annual decline in new cases. Does that concern you? There's a re-emergence of polio in some parts of the world. How worried would you be about that?
Well, polio is a very high priority for me. I spend a lot of time on it because we are close to eradication. We only have 2 countries where we've never gotten to zero, Afghanistan and Pakistan. The progress in Pakistan was looking very promising. These floods, which are, broad tragedy, I'm sure are going to delay that work, but I'm still very hopeful that we'll get the final cases. If we don't get those, then it can spread back. So it's a very high priority. HIV, we do have some new tools coming. As you say, the progress has not been as fast as we'd like. But the diseases that affect developing countries, that's the big thing the Gates Foundation does. And, I'm actually optimistic that progress will resume.
So what is going to be the big focus area for the foundation in light of the many, many challenges that we've just spoken of? And has this period of uncertainty and extreme volatility changed your outlook as a leader, changed you as a person?
Well, it's daunting that, climate's gotten worse. The foundation has deep expertise in avoiding childhood death. And, that's what we're most proud of. We partnered with people there. We cut it from 10 million a year to 5 million a year. We'll get it down, cut it in half again, not by 2030, but in the 2030s. So, we're kind of steadfast in what we're good at, what we believe in, helping the poorest. And, we'll just have to be smart to deal with all these challenges.
And changed you in any way?
It's made me say, wow, the world is a volatile place. But, the values of saving children's lives, there's nothing that's changed about that.
Bill Gates, always a pleasure. Many thanks for joining us here on the Global Dialogue. Appreciate your time.
Thank you.
Welcome back. You're still with us on Global Dialogues. As a part of its annual Goalkeepers campaign, the Bill and Melinda Gates Foundation has announced the winners of its Goalkeepers Global Goals Award. The foundation essentially recognizes the work of 4 remarkable changemakers who help achieve sustainable development goals within their communities and around the world. Of the 4 winners announced is Radhika Batra, who is the co-founder of the non-profit organization Every Infant Matters. The company provides last-mile health solutions to the disadvantaged children in India. On the sidelines of this event, CNBC-TV18 Shereen Bhan caught up with Radhika Batra to talk to her about her journey thus far and how she's helping change the world. Take a look.
This is not your first award or the first big recognition for you, but take me through how you feel today for the work that you've been able to do and that being recognized on a global platform like this.
I think it's an incredible honor. And I feel excited, but nervous. And I also feel very, we're very cognizant of the fact that the Gates Foundation has put in a tremendous amount of trust in us. And we hope to do a lot more work in the future for the betterment of the country and the other countries that we work in.
And that's what I want to talk to you about, Radhika. Yeah. I was watching your TED Talk where you talk about how getting into healthcare was a very personal decision for you. It's been a very personal story, a personal journey for you. And then the decision to actually try and do something about making healthcare more accessible, more affordable. Explain to me, from the point where you started to where you are today, what have been some of the biggest challenges that you faced?
I think the first biggest challenge was actually starting out. It's very difficult to pick a point to start. It's very difficult to pick a cause to start. And because I was working in pediatrics, I saw a lot of children become blind because of not getting good food because they were malnourished. And that was something which I picked, and I took it from there and let it take a ripple effect. So that was one of the bigger challenges of starting out. And since then, I think every day is a challenge. Being a woman in the Indian society, it's not well accepted if you're doing something a little out of the box. So it gets challenging to face questions questions of the family, of extended members of the community of why.
What are the questions? I would imagine that they'd be very happy to hear what you're doing.
No. So a lot of them are all about, you need to get married, you need to have kids, start a family. Why not do that?
Are you feeling like a ticking time bomb?
So that's the whole thing. I don't, and that's a problem to them. That why doesn't she feel the ticking of the clock, and why doesn't she focus on her family instead of going heads-on into something so challenging?
I think this is probably going to change that, and you won't have to answer as many questions as you have been. But since you're talking about pediatric care specifically, and this is a challenge. It's a global challenge. It's not just an Indian challenge. But in terms of being able to mobilize support, in terms of being able to get organizations to support what you are doing, how have you tried to build the ecosystem out around you?
I think, the work and the kind of impact that we have, it speaks for itself. So it's been relatively easy to find support, to find the right stakeholders to take the lead, and then, scale up from that one hospital in Ghaziabad to in the 5 countries that we are in today. So I think it's all about starting out and wanting to make a difference, getting up in the morning and really feeling that heat of, this is what has to change in the world, in the country, and then taking it from there. And then the support sort of, that energy sort of, drives support, and it garners a lot of positive energy with it. So I think it's attractive. So.
You're talking about being able to build scale. It's hard enough to build scale in one country. You've decided to sort of travel outside and take this across different borders and different boundaries. What's that experience been like, and how much of the healthcare challenge or the broken healthcare system is similar to what we experience in India?
When you look at the healthcare structure of India, of Nigeria, of Kenya, the problems are not different. The problems are not different. Their solutions are not different. They just have to be adapted into a more socio-culturally acceptable form and applied to those communities as well. So it's, we can't sit in India and feel like another country is not our problem. We can't sit in Delhi and feel like the Northeast is not our problem. The world is one family, and ultimately, whatever problems are there, they will reach us one day or the other.
Well, that is Dr. Radhika Batra, the recipient of the Goalkeepers Award by the Bill and Melinda Gates Foundation. We will take a break and be right back with you with a lot more.